My name is Dr. Rick Seguil.
And action. Hey, Jay had a... This is Kirk And action. Hey, everyone. It's Dr. Rick from Herbal 411. So, Amy had a question about how intense to exercise. And intensity of exercise is a very subjective measurement. So it kind of depends from person to person. However, just for us, just for our video, we're gonna assume that you're a middle-aged couch potato who has some form of exercise experience back in high school but hasn't touched a weight or been to a gym, maybe go to a gym every once in a while in the last 2 decades. But assuming that, we'll have this discussion. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. And share this with other people that are kind of trying to find their way, because there's a lot of great information out there. There's also a lot of just outright dangerous information. The lucky thing is that if you go to a lot of the gyms now, you can find a gym around you. Planet Fitness is mine, $10 a month. There's also Anytime Fitness, Something Fitness 19, Charter Fitness. There's a lot of them that are cheap, and they do have trainers there that can give you a bit of guidance. It depends on the trainer, because there's different levels of certification for being a trainer. There's also experience. So just be careful about your coach. And if you really have a medical ailment, you should be getting clearance from either your orthopedic surgeon or your sports medicine doctor first, or maybe a physical therapist to put together the program before you apply it. That way it's paid for by insurance in most cases. So we're going to talk about what to do with the average computer geek sit-down person that's telecom, that's usually, or just a couch potato. Now, the easiest thing to see as far as the progression of where you want to be is you want to go from nothing, couch potato, to walking on a regular basis. They'll get a little bit of leg work in. Won't do anything for the upper body, but you get some leg work in. You might be able to get a little bit of cardiovascular challenge, a little shortness of breath, a little bit of fast heart rate, a little bit of sweating. And those are usually deal breakers for a lot of people that don't exercise. I used to have patients that would say, I love yoga, I just hate sweating. I'm thinking, what? So usually sweating is a byproduct of a fast heart rate. Fast heart rate and fast breath, respiratory rate, is a byproduct of muscles having more demand. And when muscles are challenged, they grow. When they grow, they secrete testosterone, estrogen. They get glucose out of the bloodstream. In fact, exercise is the number one thing that you should be doing before getting on insulin and oral hypoglycemics, because it's a backdoor secret passageway for getting glucose out of the bloodstream into the cell. Really, you should be watching how much carbohydrate you have and getting fiber, but anyway, I don't want to digress too much. In addition, the first treatment of choice for depression is usually exercise as well. It's just that if you're severely depressed, it's going to be very hard to get the motivation to go and do exercise. So just like anything else, whether it's depression, heart disease, diabetes, high blood pressure, osteoporosis, if you have this built-in activity progression early on in your life, maybe middle age, 30s to 40s, then it'll be a piece of cake when you turn it on again at 50 to 60. And it's okay if you never did that or don't have that kind of experience, you can still turn it on. You just have to be more mindful of the diseases that you have accumulated and the side effects you can have to exercise. And yes, exercise you can have some side effects. The biggest side effect with exercise is if you're already on medicines, it can actually make you healthier, so the medicines will be very powerful for you. Like, for example, if you're on diabetic medicines and you exercise regularly, you'll actually lower the blood sugar so that the medicines you're on will make your blood sugar super drop. It won't be the exercise. You don't adjust the exercise and stop the exercise. You just get off the medicines or adjust your medicine dose. And don't do that without asking your doctor. So how do we start this? You go from your couch to just walking. Get a little bit of exercise tolerance. Get outside. Get your legs kind of ready for going around the block a couple times, or in Illinois, a forest preserve. I wouldn't go to the forest preserve by myself. Maybe in the wintertime, go to the mall. If you live in Elgin, there's the center of Elgin. As long as you show your ID, you can park in the overhead parking lot or the covered parking lot, walk over and do the upper deck, the track, for free. That's part of the city of Elgin's gift for you. So I'm sure if you watch this from afar, you can figure out what to do as far as walking. I like to suggest that exercise should be started with a goal of at least 90 minutes a week. That's only 1% of your total hours per week, 90 minutes. That's not much to ask. And forget the intensity, this is just to get out and do something. Once you get used to that, you've kind of test driven the car, you know that there's no flat tires, that that the engine's working on all 4 cylinders or 8 cylinders. Then you can maybe do a little bit of hiking. That's just walking with a backpack and maybe sticks. Gets more upper body challenged. You have to have a backpack, or you should have water in your backpack, a little bit of weight. I've got other videos I'll put down below where I show you how to use weight in a backpack, a water weight in the form of jugs, just to give you a little bit of resistance, so when you're walking you have a little more work to do. And the sticks that you use also use upper body, so you're going to tie in more muscles to recruit. And it's not the exercise of lifting or resistance exercise, but it's more challenging cardio. And then when you tolerate that, then you can move on to jogging or running. Jogging is such a 70s word, but running, as long as you have passed and not had any injuries, and you have good shoes, and you have a good surface to run on, and you're not going to be hit by a car. Maybe even cardio in the form of, or cardio is the next thing, but if you don't like jogging or you have bad knees, getting a bike, a trike, anything that can get a stationary bike, anything that get your movement and your heart rate and your blood pressure kind of going. So all that is important to give you a challenge, because being a couch potato, your metabolic rate is really lousy. Sorry to say it, but it's lousy. And that's why most people that do just couch potato exercise will have weight problems and cholesterol problems and blood pressure problems and diabetes problems or pre-diabetes problems, because of not doing the activity that humans are supposed to do. When you progress on to cardiovascular fitness and challenge, that is getting at least the circulatory system moving. And that's going to be a great feeling if you do it properly and not get injured. Now, if you have fibromyalgia, you really have to be careful. Chronic fatigue, you got to be careful. If you have osteoporosis, definitely got to be careful. I'm not saying you don't do that. You have to, because again, treatment of choice is exercise of some sort, but it has to be personally designed and prescribed. So exercise physiologist, physical therapist, sports medicine, integrative wellness coach, look for the best people. Hear or listen for word of mouth as far as great success stories. You'll find a good one. If you get hurt, backtrack a little bit, see your doctor, sports medicine, physical therapy. But if you don't have any problems, then you go from cardio, where you're doing that 90 minutes a week at least, but maybe so you have a more compressed goal. So 90 minutes, for example, in 90 minutes, if you walk 2.5 miles an hour, you have a certain distance that you can hit at the 90-minute mark. So if you know that mark, and every week to 2 weeks, you try to beat it. You try to get a longer distance, or you try to do the same distance in less time, or you try to put more resistance and do the same distance in the same amount of time. Whatever it is, you try to challenge your muscles and your cardiovascular system. Keep on trying to challenge without hurting. And that's how we push and learn. Push and learn. And what the learning part is what the muscles are kind of getting used to. Because the muscles, when you push them to a certain amount, they will rebuild to tolerate that stressor. So it's called hormesis. Hormesis is when you put a stressor on the system or the animal or the life, and the life the animal or the living being tries to improve so that the next time the stressor is experienced, you can get better at it and tolerate it more. So the cool thing about human physiology is that they can tolerate a lot. You just have to do it accordingly. So after you got the cardio out, or you've rocked it as far as some form of cardio, 90 minutes intense. And so I guess that's back to the same question that Amy had. Intensity can be measured in the form of perceived exertion. The only problem with perceived exertion is I can see people going like that, even without doing anything, just to get past the practice. I've seen that in high school. We used to have, it was called dogging it. If you did like 100-yard intervals, and then you did 200-yard intervals and then 400-yard intervals, if the coach saw you and you're just laughing and standing around, he'd make you do more. If the coach saw everybody grabbing their knees and like short of breath or vomiting, he'd probably back off a little bit. So a lot of my friends would dog it. They'd just be short of breath and laughing as they were pretending they were short of breath around the other end of the track. So So perceived exertion can be subjective, so kind of okay. But heart rate is good. You can't really lie on a heart rate monitor. Those watches are cheap now. Steps per day, can't really lie on your steps per day. And then VO2 max, if you have really fancy watches that calculate that stuff, that's cool. So those are the standard things that you can get like minute to minute to help you figure out if you have to push harder. Because if your heart rate isn't going and you're short of breath, that's probably perceived exertion. If your heart rate is really tachycardic and short of breath and just winded and about to pass out, that's pretty decent. Now, it sounds terrible that you have to be to the point of passing out, but I just came back from a leg day at Planet Fitness and near vomit, but I know when to stop. Why? Because I want to challenge muscle so that the next time I'm working up to a max again. And summer's coming up, so big hikes are coming and big mountains are coming, so I got to get in shape. So that I know I have to challenge myself, and that's the easiest way to challenge. Just pushing to the point of not feeling sick, but also pushing so that there's stimulation and the hormesis will kick in. If you do the right amount of exercise resistance-wise, you will be able to develop type 2B muscle fibers. And then there's something called Henneman's law of calling in different muscles depending on the stressor that you're experiencing. So just a little bit of walking, type 1 fibers get called in. A little more aggressive walking, type 1 fibers, type 2 fibers get called in. You burn more glucose and fat. A lot of cardio and lifting and resistance, type 1, type 2A, and type 2B are all called in. And that's when you have a really good workout. That's when you're fit. Metabolically fit is when you can burn what you eat. It also is when you can run away from danger. So all this stuff is important. Why? Because of longevity. The more muscle mass you have going into your 70s, I really think the less disease you'll have. If you wait till you're 60, going to be a challenge. If you continue from 20s to 30s a little bit, from 30s to 40s a little bit more, but fine tune it, from 40s to 50s, change it around, but adopt it for age. 50 to 60, again, change around, adopt it for age. You'll see that that one rescue will always be with you. The rescue being that the first treatment of choice for any disease process is always move. Second treatment of choice, like I mentioned before, is always have a nutrition practice that's healthy, that was be sustaining. I don't care if it's vegan, paleo, keto, fasting, doesn't matter. Whatever it is, if you can do it and sustain it, that works for you. Just have to fine tune it depending on your results. And then having some form of calming practice. So all those things are important, but again, in this scope, we just want to get you moving, not hurt, but progressing forward. So if you can't afford any of that stuff and you're going old school, then sometimes going to your doctor office, your visit, and at least checking vital signs, blood pressure, BMI, weight, that's weight to height ratio, your heart rate, and also maybe some blood markers of inflammation, cholesterol, glucose, insulin levels, inflammation markers. All that would be a nice way to gauge, but insurance doesn't always cover that. If you at least do that every 6 to 12 months, you can get a pretty decent snapshot that you are progressing properly or you're dogging it. So whatever you can afford, whatever you can do, just try to move. And if you're stuck on the couch because you have back pain or you're depressed, then you have to have medicines first or surgical intervention first. But even after the medicines and surgical intervention, you still got to be moving, because in the next 1 to 10 years, whatever the problem you had that was keeping you on the couch will be magnified. And the only way not to magnify it, to reverse it, is really to change your lifestyle. Medicines I love. I think surgeries in the United States are great, but we as doctors kind of forget what to do. Actually, don't kind of forget. We just don't know. We're not taught in medical school what to do with exercise or nutrition or mindful practice, which is usually my 3 caveats that most patients don't do or haven't maximized on. So if they have, then usually I call that visit with my patient kind of boring because there's nothing for me to do. I'll say, see you in a year to 2 years, but they're out of my office in 15 minutes. But as you all know, if you're my patients, most patients are not out of my office in 15 minutes. Most patients are out of my office in 45 to an hour. So that's why I'm always behind, sorry. But that is it. So Amy, hopefully this gives you a little bit of a template on what to do with regards to your routine. Don't get hurt. Get some coaching available if you have it. If you don't, consider beg, borrow, or steal if you hit the wall. If you can do it on your own, great. Keep on progressing, and if you get bored of the challenges, then have somebody else challenge you. That's one good thing about finding a coach, is that they will always be feedback to improve or to shortcut your transition to being healthy. If you kind of have no motivation, then it's good to be, and you don't have a coach, get a group. I know there's great groups out there. I have Endorphin Effect right next to me here. Good society, a good culture. Also have TNF and Elgin, run by Maritza and Freddie. Excellent culture. Those guys are rocking it. I see people losing like 100 pounds at a time. A couple of my patients go there too. Very good success. But that's because you have the motivation of the group, the coach, the facility to keep you going. So having an exercise routine on your own and in your basement, a little challenging. Boring if you ask me, but you have to see how you can invest in this properly. But definitely it's an investment, but the payoff is so great. So Amy, hopefully this helps. Everybody else, if you have any questions on what you do to maximize your intensity, put them down below, or how you measure your intensity, put them down below, and maybe we can all learn from the same thing. Otherwise, I'll see you in the next clinic.